Thank you, Mr. Chairman. When COVID-19 hit, the federal government was not adequately prepared, and we have not done enough to prepare for the next threat. Unfortunately, the legislation the Republican majority has noticed for today continues to leave us vulnerable to future threats. It fails to make any significant new investments in our pandemic preparedness. It further politicizes public health by overriding the scientific decision-making of our public health agencies, and Republicans have refused to include any legislation at this hearing to strengthen the resilience of the supply chain. Now, throughout the public health emergency, healthcare providers, states, and emergency responders face supply shortages of ventilators, PPE, critical medication, and testing supplies. And now we're seeing shortages of chemotherapy drugs that are threatening the path to recovery for so many patients battling cancer. Weeks ago, Democrats introduced 5 bills that would help us strengthen the supply chain, and none of these bills were included in today's hearing. Ranking Member Eshoo introduced a bill that would bring transparency to drug manufacturing. The United States is over-reliant on foreign suppliers for critical drugs, and unfortunately, we don't even know how bad the problem is or which drugs rely on foreign suppliers. And Ranking Member Eshoo's legislation would help the FDA understand the entirety of the drug supply chain, which would be beneficial if there is manufacturing or quality issue that could lead to a shortage. FDA would then know what suppliers drug manufacturers are relying on so that it could quickly address the problem. When drug shortages happen, FDA can work with sponsors to extend the shelf life of the drugs available in the market to the latest possible date without losing drug quality, effectiveness, or safety. However, obtaining scientific information from drug sponsors to support an expiration date change can sometimes take weeks or months, that is, time patients may not have. The Ensuring Access to Life-Saving Drugs Act, introduced by Representative Slotgood, would streamline this process. Additionally, we know that there are times when FDA is not even aware that a shortage of a product is coming. When there are unforeseen demand spikes, FDA has little insight into these issues until the problem is already impacting patients. Bipartisan legislation from Representative Jacobs and Mills would ensure manufacturers notify FDA when these demand spikes occur. Right now, there is also no requirement in place for medical device manufacturers to notify FDA of supply problems. Representative Castor has introduced a bill to fix that. We also requested that the Republican majority finally take on the glaring drug safety risks that exist when a dangerous or contaminated drug must be recalled. But FDA has no power to take it from the shelves. And this committee has worked to fix this problem before on a bipartisan basis, and it's time we finally get this done. I honestly think that the Republican majority's refusal to include these bills at today's legislative hearing is irresponsible. You know, I've heard the arguments. Mr. Hudson suggested that the disarray on the floor makes it impossible for us to move ahead with a lot of things or to do much at one time. I don't want to put words in your mouth, but that's how I interpret what you say. And, you know, I'm sorry, but the Republican disarray on the floor should not be the basis for us not to act. Because I don't know, at any given day, I mean, we had 4 days pass without voting on anything. So what does that mean? I'm just supposed to not introduce bills or try to act on anything because, you know, some people on the right are going to take down the speaker? I mean, we can't act on that. I mean, we can't proceed based on that. And PAPA is a must-pass bill. So if we don't include legislation addressing drug shortages now, it's just not going to happen. There's not going to be enough time. So that's why we continue to insist that these bills dealing with the shortages be included. Now, while the majority was not willing to include drug and device policies, a few bills noticed for today's hearing would make strides toward improving our public health response. A bill introduced by Representative Underwood would strengthen real-time standardized data availability of emerging public health threats at the CDC. As Dr. Walensky and others have testified during the COVID-19 and Mpox public health emergencies, CDC was often left with incomplete, inconsistent, and out-of-date data that hindered our response, and this legislation would clarify their authorities, helping us to prepare for emerging threats going forward. We're also considering my bill to remove the requirement that the Senate confirm the CDC director, a misguided change that the Senate insisted on including in our omnibus package at the end of last year. When President Biden took office, it was important that he was able to immediately appoint a CDC director to lead the agency during the COVID pandemic, and it's critical to have an expert CDC director in place right away to respond to the public health threats with speed, focus, and foresight, and without furthering the politicization of public health that has become too common commonplace. And we all know that the Senate doesn't do anything quickly. So, again, I have serious concerns about policies that would allow congressional interference in the termination of a public health emergency, new and unworkable requirements for CDC guidance, and industry decision-making of the FEMC. While it concerns me that the Republican majority doesn't seem to appreciate the full scope of the challenges we face, I hope we can find a way to move forward in a comprehensive bipartisan way, because it's important that we come together to learn the lessons of COVID-19 and reauthorize PAPA on time. And with that, Mr. Chairman, I yield back.